Hello everyone, welcome back to my channel. Mind Gets Motivated. I hope you all are fine and I am fine too. And I'm very happy to and that I'm coming back, that I've come back after so many months, to make this useful video for each and every student out there. So I'm starting the Target GPAT preparation series from today. In the meanwhile, I'll start the NIPER preparation series also very soon. So as you all know, in the previous video, I have shared a small this thing no introduction to GPAT. What is GPAT? So it is Graduate Pharmacy Aptitude Test, which is being conducted by AICT till 5 years or 4 years back. After that, till last year, it was conducted by NTA, that is National Testing Agency, but this year it is being conducted by NBES. So they have mentioned that the syllabus of GPAT is the PCA BPharm syllabus, which we usually prepare for our semester exams. Okay, so coming to the subjects to be studied for GPAT, so it is nothing but our the BPharm syllabus only, or the SEM syllabus. So here I have categorized the subjects into the minor subjects and major subjects. So major subjects usually cover major portion of the paper. Usually if you cover these subjects, you will be passed just like that. Okay, and if you study the minor subjects, it will increase your score, it will increase your rank. This is the deciding factor, the rank deciding factor, I say. So the see major subjects, if we see, it is pharmaceutical analysis, sutics, organic chemistry, medicinal chemistry, ecology, cognizy. We see minor subjects, HAP, inorganic chemistry, biochemistry, pathophysiology, physical pharmaceutics, microbiology, engineering, jurisprudence, nothing but forensic pharmacy also we call, BBPK, that is biopharmaceutics and pharmacokinetics in biotech. So in each and every subject, I've just noted down some of the important topics to be covered. Okay, and what are the books to be referred. Okay, so it is very useful for the people who are starting the preparation now. So if you start with me, daily I'll be uploading one video, so that at least it will be useful to you guys. And if you see, in the case of pharmaceutical analysis, okay, just take up an book and note it down, what are the topics. So, if you see pharmaceutical analysis, the methods of expressing concentrations like molarity, normality, mole fraction, molality, percentage weight by weight, percentage weight by volume, percentage volume by volume, etc. Then all types of titrations like acid base titrations, what are the acids, what are the bases used, what are the indicators used, what is the color they are giving. In precipitation titrations, complexometric titrations, what are the complexes used, what is EDTA and all. Okay, then conductometry, polarography, potentiometry, not so important topics, but at least if you have time, you can just refer. It is a knowledge kind of thing. Okay, then coming to the main spectroscopic topics like UV, IR, okay, fluorimetry, and all chromatography techniques. What are the principles, what are the what are the detectors used. Okay, then NMR and mass usually is not given in our BFM syllabus, but it is better to read this topics also, like NMR and mass, which I'll be covering very soon. Then the books to be referred: Vogels, Y.R. Sharma, then Silverstein and Pavia. Okay, then coming to the pharmaceutics, like various dosage forms, prescription parts, posology, the formulas for adult, for children, what diseases. Okay, then pre-formulation concepts and tablets, what are the binders, or what are the excipients used, capsules, same excipients and all, parenterals like IVIM dosage forms, ophthalmic preparations, then cosmetics, then aerosols, then packaging materials like what is advantage of alumina over steel, or what is the disadvantage of steel over plastic and all, etc. Then liquid orals like suspensions and emulsions, then pilot plant scale up techniques, then technology transfer, then regulatory requirements like what is NDA, what is ANDA, when it is used and how it is used. In books to be referred, like I prefer Lashman, which is a very standard textbook, then followed by Alton's, Cooper and Guns, or Gilbert S. Banker. Okay. Then cognizy, if we see introduction, classification of drugs, and classification of all drugs, like based on morphological or something like this. Okay, and quality control of drugs, like whether the this part is how it is adulterated, what are the definitions. We have three definitions or four definitions which I'll be covering. Okay, particular the subject video. Then plant tissue culture, then primary metabolites like carbohydrates, lipids, fats, then secondary metabolites like alkaloids, glycosides, tannins, resins, etc. So usually the drugs are very important. So if you take a plant material, you should know its source. Okay, then what its chemical constituents, what are its uses. And pharmacognosy in various systems of medicine, like we have Ayurvedic system, homeopathic system, Unani, etc. Then metabolic pathways like shikimic acid pathway, mevalonic acid pathway, glycolysis, these all are very important. Then books to be referred, Kokate, standard textbook, you all know, then trees and events. Then medicinal chemistry and ecology is to be read combinedly, I say. Okay, so if we say the classification in both the subjects of same drug, if we say antihypertensive agents, both will be almost same, but they'll be little different because that is ecology, this is structure based. That is the uh, mechanism of action based. So I prefer to say read at a time. Like take the classification of so and so like antihypertensive agents. Read from college textbook, a scale triparty, and then read the practice the structures of the drugs, like important drugs. And you should remember what is heterocyclic ring present in so and so drug. Like what is heterocyclic ring present in propranolol. Usually there is no heterocyclic ring because there is a naphthalene ring, okay, present in propranolol. But you should know what is the heterocyclic ring present in so and so drug. So that is very very important. And SAR also. SAR matters in medicinal chemistry, as you all know. See the books to be referred: Wessel and Geswald, Foye, Burger, and Algarsami. Okay, then pharmacology, you all know what I've told you earlier also. So the other than these topics like immunopharmacology, you have to see principles of toxicology, like what are the acute toxicity studies, subacute, okay, chronic toxicity studies, etc. Then chronopharmacology, that is the biological rhythms we say. Then books to be referred, KD Tripathi. Okay. Then Rangendale, very standard book again. Then Sharma and Sharma. It is very easy to understand, concept. Then organic chemistry, a very important subject. It's very easy also. Impact nomenclature and isomerism, like optical, geometrical isomerisms and all. Then alkenes, meaning all the functional group related compounds. You have to see its synthesis, its reactivity. Okay. Then alkenes, dienes, alkyl halides, alcohols, carbonyl compounds, carboxylic acids, amines, benzene and its derivatives, and fats and oils. Like what is saponification number, what is the formula of it, what is acid number. Okay, they'll give one. Problem over there. So you should not panic over there. Okay. Then cycloalkanes, then polymer hydrocarbons like naphthalenes, uh, anthracenes, phenanthrene, etc. Okay, and heterocyclic compounds, very important topic again. To see, like if you take a pyrrole ring, what are the methods of synthesis? Like norpyrrole synthesis is there. So what are the two starting materials? They will ask. They'll give just name, or they'll just give the reaction and what is formed. They'll ask if they give two starting materials A plus B, arrow mark. What is C? They'll ask what is C. They'll just give four options and you have to choose in that. So you have to know each and every concept in that. Okay. Then again, nomenclature of recycled compounds is also very important. Just read it. Or, I'll be explaining each and everything. You did not worry. It may be a bit late, but I am assuring you that I will surely make all the videos regarding all the topics. Okay, whatever possible with me, but chemistry topics, everything I will cover. And other than that, analysis also I'll try to cover. Ecology also, remaining all medical chemistry also I'll cover. Classifications and all, how to read, how to okay, get over things, and I'll just do it. Do not worry. Then named reactions, all the named reactions you see, like what are the static materials used, what are the reagents used, etc. And what are the intermediates also. If you say Riemann-Tiemann reaction, the intermediate is the carbenes. Okay, so you should know that. Books still be referred, Morrison and Boyd, Finar, Bal and Wall, and Rajki Pansa. Okay. Then the less important topics, like less important subjects, as the minor subjects, HAP. HAP, Introduction to Human Body, then all the body systems, genetics. The books still refer Tortora, Human Anatomy, Rosen Wilson. Then come to the inorganic chemistry, limit tests, Acids, bases, and buffers, use of various products like expectorant. They'll give one expectorant. They'll ask what is the use of this compound. So you should be able to answer. Now, read of pharmaceuticals. I'll make you to read all those things. Okay, you need not worry. Sorry, then books to referred Gundurao and Chatwal. Then come to the biochemistry, carbohydrates, lipids, amino acids, nucleic acids, everything. DNA, RNA, what is the structure of this, what are nucleotides, what are nucleosides, everything. They may ask anything. Then cycles like glycolysis is very, very, very important. You all know it. And it's very easy also, right? So they may ask how many ATP molecules are consumed, or how many ATP molecules are released in glycolysis pathway, like that. Then enzymes. Then coming to the books to prefer, Satyanarayana, very good book, Leninger and Harpers. And pathophysiology, if time permits, you read pathophysiology also, like basic principles of cell injury and adaptation, like what are the five signs of inflammation, like that. Then basic mechanisms involved in the process of inflammation and repair. Then etiology, pathogenesis, signs and symptoms, and complications of a particular disease. Like if you take hypertension, what is the etiology? What is the cause behind it? What is the pathogenesis? How it is leading to hypertension? What are the signs? What are the symptoms? And what are the complications? Books to be referred Harsh Mohan, Robbins, Goodman and Gilmans, and Roger Walker. Then physical pharmaceutics, again, very important topic. Like solubility of drugs, if you take pieces classification is very, very important. They'll ask which class belongs to low solubility, high permeability. You should be able to answer. Then states of matter. Other than solid, liquid, and gas, we have gaseous state, we have supercritical fluid state, like that. Then surface and interfacial phenomena, then complexation and protein binding, buffers and isotonic solutions, like what is hypertonic, what is hypertonic, what is the isotonic solution of sodium chloride. You have to say that is 0.9 percentage. Okay. Then colloidal and cause dispersions. Then rheology. Rheology is very important. Okay. Then micromeritics and drug stability. So usually for drug stability, they do accelerated stability studies. So you should know that also. Then books to be referred, Martin's, very nice book. Then Sibis Subramanian books. Then for microbiology, for prokaryotes and eukaryotes, you should know the structure and differences. Then types of microscopy like dark field, bright field, okay, and scanning electron microscopy, phase contrast microscopy. Then bacteria, its structure, morphological classification, nutritional requirements. Okay, then staining techniques like for gram positive, gram negative, what is the difference? Then methods of sterilization, fungi, virus. Okay, disinfectants. Now, sterility testing and microbiological assay you'll find in Indian pharmacopoeia. Please refer to that. Okay, I'll also share, but just refer to that. Okay, then the textbooks to be referred Pelzer, and then Hugo and Russell's. And for pharmaceutical engineering, flow fluids, okay, it's very important. Then all unit operations like size reduction, size separation, heat transfer, and materials of plant construction. So usually they'll ask very less questions, very less to very less questions, like one or two they'll ask. Okay. Then books to refer like C.V. Subramaniam is very nice textbooks. I used to refer in my B farm C.V. Subramaniam, part one and part two. Remington. Then jurisprudence as forensic pharmacy, you should know each and every act, in which year it was implemented and which what are the rules here also. And in case of Drugs and Cosmetics Act, you should know what are the schedules. What is Schedule M? What is Schedule A? What is Schedule N? You should know each and everything. Should read that. And books to be referred BM methyl and NK Jane. Then BBPK, all the ADME process like absorption, distribution, elimination, excretion. Okay. Then bioavailability and bioequivalence, and we have pharmacokinetic models like multi-compartment models, non-linear pharmacokinetics and linear pharmacokinetics. Should know all the formulas. Okay, I'll be sharing with you. Do not worry. Then I used to refer actually Brahmankar. So if you find any other good textbook, please share it in the comment box so that each and every student who watches my video will be able to know it. Then biotechnology, very less questions. Either they will ask one or they'll not ask also. But for safer side, I have just mentioned what are the topics to be referred, like enzyme biotechnology, biosensors, use of microbes, then RDNA technology. Okay, types of immunity like immunoblotting techniques like ELISA, then mutations, fermentation, and blood products. So books to be referred, I found only these two textbooks actually. So if you find other ones, please let me know in the comment box. And for immunology QB and for principles of fermentation technology like Stanbury is there, Whittaker and Hall. So these are the okay, these topics or the subjects. So thank you for watching my video. From today onwards, we'll start our target GPAT preparation series with very less stress. You should enjoy reading, you should enjoy preparing for the exams. It's like a challenging task, which you should prove others that you're not less than any other person. Okay, never ever compare yourself with others. You are unique and you are unique to yourself. Okay, so please do not let your motivation go down. If not this year, you will qualify next year for sure. You have made your BFM complete. Why not? You'll be able to clear the GPAT. It's just a MCQs test. You'll be able to clear. Just read it with clear mind. Do meditation if possible with you. Do yoga and all. Okay. Thank you for watching this video. Mind should be always get motivated. It should have you should have fire in you to achieve something very good, and you should you, your parents should be proud of you that my son is has qualified this, my son is doing so and so and so. Thank you. Please like, share and subscribe. Please share it to the needed ones. Thank you, thank you, thank you once again. Bye bye, have a nice day.